discuss about the mechanism of labor. What I'm going to show you is the normal mechanism in a left occipital anterior. Okay, so you'll know that this is a left occipital anterior. So again, the arterial would be a flex head. Here it is left side, so the occipital is sitting in the transverse position. So LOA. Okay, so now in LOA, normally the head would engage in the transverse diameter. So LOA and LOT are the commonest types of presentations. So the structural suture is in the center. Okay, now the first thing that happens is engagement, descent with engagement and flexion. So what is engagement? I already told you all, only if the BPD passes through the pelvic brim, you will say the head is engaged. So now the head is not engaged, now it is engaged. So it is, as with good uterine contractions, the head descends, so engagement occurs. So descent, engagement and flexion. Now as soon, so once the head is descended and the head is engaged, when you do a vaginal examination, the head is almost at the level of the ischial spines. This is the ischial spines, so the head is almost at the level of the ischial spines. So that is where, so when you see abdominally, you will not be able to see any part of the head except a small bit of the sinciput. Occipital is not there at all. Okay, can you see only the sinciput is felt, only small part of the sinciput is felt, the occipital is not felt at all. So in other words, you would say the head is only 1/5 palpable, means only the sinciput, occipital is not felt, and when you do a vaginal examination, you feel the head at the level of the ischial spines. So what has happened is, you've had descent with good flexion and engagement. Now once the head touches the ischial spines, you have the levator muscles there, and what happens next is internal rotation. Internal rotation is the head will rotate through 1/8 of a circle or 2/8 of a circle, depending upon where the head is. Supposing the head is in the transverse position, it will undergo rotation through 90 degrees. If the head is sitting here, it will rotation occur by 45 degrees. So internal rotation occurs, and then the occipital will hitch against the pubic symphysis. Head is being borne by a process of extension. Okay, and then the next thing would be a restitution, external rotation and delivery of the baby. Let me show this in your with the help of a dummy. Okay, so the first thing is LOA. So with good uterine contractions, head descends, and whenever there is a good uterine contraction, flexion of the baby's head also occurs. Okay, so descent, flexion, and then engagement occurs. Once the head is engaged, it reaches the level of ischial spines where you have the levator muscles. Now the levator muscles has a special property known as heart's rule. Heart's rule means that whenever any part of the fetal skull which touches the levator muscles first is the one to get rotated anteriorly. So here in a vertex presentation, the occiput will touch the head levator muscles first, and as a result, the occiput undergoes internal rotation through 90 degrees, and that is known as internal rotation. Now when the occiput is rotating through 90 degrees, it is enough if the shoulders rotate through 45 degrees. So there is an angle between the shoulders and the head, and that is the twisting of the neck, which later on will get untwisted, and that process is known as restitution. Okay, so now so far what has happened is descent has happened, flexion has happened, and the head is engaged, and now internal rotation has happened. So the next thing is the head will hitch against the pubic symphysis, and the head is being borne by a process of extension. Now as soon as the head is borne by process of extension, let us see the relationship between the head and the shoulders. The shoulders are in the either in the transverse diameter or in the oblique diameter. So untwisting of the shoulders occurs, and that is known as restitution. Now, so the shoulder is still now in the oblique diameter. So from the oblique diameter, the shoulder should rotate and come to the anterior diameter. So that internal rotation of the shoulders corresponds to the external rotation. Okay, so next thing to happen would be the anterior shoulder hitches against the pubic symphysis, the posterior shoulder delivers, and the rest of the baby delivers.